Dr. Weiner?
Pastor Montgomery, how you doing, Dr. Williams?
Good evening. Good evening. Good evening. Welcome to this evening's webinar of the National Baptist Convention USA Incorporated, Turn Obesity Around, part of our regional webinar series, beginning with our Northeast region. And this also will serve as our kickoff meeting for our series of webinars that will continue through the fall. We certainly hope that you have had a blessed day. We also will remind everyone that they can ask questions, make comments, and post in the chat. We're preparing shortly now to receive greetings from the chair of the board of the National Baptist Convention USA Incorporated on behalf of our president, Dr. Jerry Young. So let's now send it over to Dr. Boise Kimber.
Thank you, Dr. Miner, and to all of you who have joined us on this evening. I bring you greetings from our president, Dr. Jerry Young, and from the board of directors, executive committee of the National Baptist Convention USA Incorporated. I want to thank Nova Nordis for partnering with the National Baptist Convention in this ongoing seminar and to help us to talk and to relate and to learn more about obesity. Let me thank those from the Northeast who have joined us, and I'm sure that there'll be more to join us tonight. Dr. Miner, I want to thank you for the job that you are doing with our health initiative in our convention. And to, again, on behalf of our president, Dr. Jerry Young, board of directors, members of our convention, I want to welcome you and thank you so very much for being a part tonight. Thank you so very much.
Thank you, Dr. Kimber. Thank you for those words of greetings. And we also want to recognize tonight our General Secretary, Dr. Alvin Edwards, and the chair of our Federal Faith-Based Initiative, Dr. Alvin Love. And again, my name is Michael Miner, and I am the National Director of the National Baptist Convention USA Incorporated Hope HHS Partnership. All right, folks, this is history making on tonight. It's not many times that our denomination kicks off a major initiative for the first time. You're here tonight, and despite the pandemic, we're all going to be a part of this. And years from now, we'll talk about how on March 25th, 2021, you were there when we committed ourselves to turn obesity around. In America, nearly 80 million adults are obese. Sadly, nearly 50% of non-Hispanic Blacks are obese. Additionally, diabetes affects 34.2 million Americans, or 10.5% of the population have diabetes. You know what? That's 1 in 10 Americans. Disproportionately, 11.7% of non-Hispanic Black adults in the United States have diagnosed diabetes. What can we do to turn these numbers around? The National Baptist Convention USA Incorporated is launching this new national education awareness campaign entitled Turn Obesity Around. We're focused on educating our member congregations and the communities we serve about the adverse impact of obesity and diabetes on the quality and quantity of our lives. This webinar will kick off a series of 7 total webinars that will introduce and define the NBC Turn Obesity Around continuum. Yes, we recognize that obesity is a major problem in our community. However, there's no one-size-fits-all solution. A continuum of intervention begins with awareness and our why. Intervention will then involve individual or combinations of behavioral modification, pharmacology, medications, and/or surgery. In this session, we will introduce the NBC USA Hope Turn Obesity Around continuum. And look, before we go too far, we want to thank our team member, Sister Nettie Johnson, and founder of Faith and Fitness Services, LLC, for giving us permission to use her model. All right, everybody. Over the next about 45 minutes or so, we will hear from 3 of our NBC USA Hope team members who will share about different aspects of our turn obesity around continuum. We're just blessed that we have such dynamic, qualified individuals that are not only part of our team, not only good National Baptists, but they are members in good standing of their respective churches. And of course, they will give a shout out because they know what's what to their pastors on this evening. All right. I'm going to begin with just a brief overview of our turnaround initiatives. Then I'll give you a snippet about what each of our panelists are going to talk about and introduce them, and then we'll get started. Look, while we are preparing to get this started, why don't you just type in the chat, or if you're on our social media pages, your name, your church or your state convention or in the city, so we can know who we have here. All right? Well, let me let you know something about myself. I'll be remiss if I did not recognize our state convention, Mid-South Churches. I'm the president for the last 7 years. Thank God for that service. And I'm also the pastor of the Hill Hernando Baptist Church in Hernando, Mississippi. All right, now I got them in. Okay. Next, Nettie Johnson. Yes, she'll provide an overview of our Hope HHS Turn Obesity Around Continuum. Let me put her up here so you can see what she looks like. All right. And she will share about physical fitness aspect of our behavioral modification. Now, Nettie, she's well-rounded, y'all. She's an author, podcaster, award-winning speaker, teacher, a National Baptist physical fitness coordinator for our convention, a degreed and NCHEC credentialed health educator. She's got multiple fitness and health coaching and certifications, and she just got selected for the prestigious Robert Wood Johnson Foundation Cultural Health Leader Grant Award, whatever you want to call it. It's awesome. She's a founder of Education for Transformation, a Christian wellness organization, and develops and delivers curated education and programming addressing Black health disparities. She's been involved in this stuff for over 20 years. Wow. She's walked the walk because she's had some of her own personal weight challenges. And because of that, she's a member of the National Weight Control Registry, the largest prospective investigation of long-term successful weight loss maintenance, comprised of, get this, y'all, 10,000 individuals who have lost significant amounts of weight. And guess what? They kept it off. She is from Denham Springs, Louisiana, with her husband, Will, and her 2 children, Jabari and Itana. We welcome tonight, Sister Nettie Johnson. Bless you, Sister Nettie. All right. Okay, who we have up next tonight? All right, we have Dr. Lavora Williams. That's who we have next. Okay. All right, let's bring Dr. Lavora Williams up. There she is. Dr. Williams, I tell you, Dr. Williams has been involved with us since we got started 10 years ago when she was 16. Okay. All right. Now check this out. She is an associate professor. She's way on up there in the College of Nursing and Graduate Studies at the University of Kentucky School of Nursing. All right. Now check this out. She is director of the Community Health Advocacy Interventions Generating Equity Change Team and the assistant director for Cancer Health Equity at the NCI designated Markey Cancer Center, where she holds, and I love this, y'all, the endowed research professorship in cancer health equity. Endowed. That means somebody left some money for somebody quality, and they decided that Dr. Lavora fit the bill. She is an endowed chair, endowed professorship. All right, but she is the chair of the MCC Diversity and Inclusivity Committee and a member of the Cancer Prevention Program. Dr. Williams received her undergraduate degree in nursing from Union University and the Medical College of Georgia. She earned a master's of nursing. Now, she just didn't stop there. She got her family nurse practitioner. Family nurse practitioner. Somebody missed that. Her family nurse practitioner. Very able health professional. All right. And from Georgia Southern University, and a PhD earned in nursing and distinction from Georgia Regents University. Her research is awesome. It aims to advance health equity among racial and ethnic minority and medically underserved populations through community engaged research methods to, affect, improve diabetes, cardiovascular disease. I'm trying to get all these things exactly right, and cancer outcomes. Okay, now I'm gonna go a step further. Y'all ready for this, everybody? She is nationally recognized for developing culturally adapted interventions for implementation by community health workers in church settings. And tonight, we're glad to have her with us on tonight, Dr. Lavora Williams. Dr. Williams, thank you. All right. I almost forgot, and she is a member of the local chapter of the Black Nurses Association. All right. And now our next panelist. Okay. I am just excited about our next panelist because I am really going to have a wonderful time reading this wonderful bio that she sent me. Okay. So we're here for Sister Ellen C. McKnight, MPA, working on her doctorate. She is a nutrition, wellness, and public health advocate. All right, she is passionate about nutrition and wellness and the intersection of what those things are. She is the principal of the Maxine firm. The Maxine firm is a nutrition and wellness firm. Matter of fact, she's been doing it since 2016. Preventing chronic diseases directly related to nutrition practices is the primary objective. The Maxine firm, that's her firm, a young Black woman, a woman of color, have her own consulting firm nationwide that facilitates the implementation of healthy lifestyle changes by way of nutrition and wellness seminars, workshops, and symposiums. The Maxine firm, that I did tell you that's the one that she runs, builds supportive infrastructures that provides our clientele all across the country with the tools needed to achieve their personal nutrition and wellness goals. For all you out at HBCUs, she has completed her bachelor's at Southern University, A&M, all right, in human nutrition and dietetics, her master's in public health administration, that completed a dietetics internship. As I said before, she's on her way working on her doctorate. She wants me to make sure I let you all know that she is a member of Alpha Kappa Alpha sorority and part of the National Organization of Blacks in Dietetics and Nutrition and the Academy. Wow, the Academy of Nutrition and Dietetics. For you tonight, Sister Ellen McKnight. Thank you. All right, I did real well on that one. Okay, all right, we're gonna get started. And look, we want to take some time out tonight so y'all can have an idea about the quality of people that we have working in your National Baptist Convention. Look, this is what we're gonna do tonight. All right, we're gonna have a panel discussion with our team. We want y'all to listen up, type in the text. We got Sister Linda Copper, one of our team members. She's going to be helping us with our questions. Respond to those. Also, for those of you all that are watching us on Facebook, and I'm just blown away blown away. Thank all of you all who have shared from our National Baptist Convention Hope Facebook page, YouTube. It's unbelievable. Right now, we're seeing that between Zoom and our social media, we're looking about 500 people who are watching us on tonight. So we thank you all for your participation. All right, everybody, let's begin. We ready? We ready? We ready? Mateen with the thumbs up. We're ready. Okay, here we go. Let me start things off. All right, in 2013, the Office of Minority Health, I'll never forget it. I was on my way down to Water Valley, Mississippi. Some of y'all know what it is. And I got a phone call from the Office of Minority Health, and they asked us if we would conduct a pilot about called Turn the Beat Around. It wanted to test the efficacy of using health ambassadors to affect sustained better individual and community health outcomes. This study took place in several Alabama cities. And I see some of the people that are on here tonight. We were down there in Birmingham and Selma and Montgomery. And we did this for a couple of years. This was what was so powerful, everybody. The results of the study showed that the intervention that we did was indeed effective. And our national director of training, Pastor Bernard Montgomery, is on tonight. We'll hear from him later about how they work. Now, this is the part that I love. Now, get ready for this. I know I see I got Dr. Stewart on here from Arkansas. The results of this study were so good that they were published in a peer-reviewed journal. I want to make sure we caught this. This was something done by the National Baptists, our people, our researchers, with our churches. And it was deemed such high quality that it went through the peer review process and was published. Now, y'all know that says something about the caliber of people that you have working for you in your National Baptist Convention Health Initiative. So I'm just going to be a poor dog on wag his own tail. I'm going to give a hand clap for those people who got that done. Y'all ought to be happy too. Okay. All right. And guess what? This began our turnaround initiatives. Okay. We worked with the Obama administration when we came out with the Affordable Care Act and wants to help turn around some attitudes about this initiative. Then we came in 2017 with the National Institutes of Health, All of Us Research Program, turning around attitudes about doing research. So this marks our third turnaround campaign. Each one has been funded. And we're so excited tonight that Novo Nordisk has seen fit to be able to fund this initiative, and we're keeping our string going. All right? So that tells us a little bit about our turnaround series. We're not new to it. We're excited about it and looking forward to all the wonderful things that God's going to bless us with. All right, everybody, let's start talking about our newest initiative. Let me bring in Sister Nettie here. Okay. All right, Sister Nettie. We're going to add you to the discussion. All right. And look, everybody that's in the chat. All right. Y'all feel at ease to ask questions. Sister Copper will help grab our attention of it. All right. Hi again, that's Sister Nettie. Good seeing you on tonight. All right. Can I just say one thing, Sister Nettie? You look different than when I saw you about an hour ago. I just want to throw it in for free.
It's an amazing thing.
All right. Okay. Well, Sister Nettie, look, before we start talking about the continuum, I just want to you just give us something about your personal story. I mean, what they say, you know, you don't know your story, so but you can tell your story. Can you just give us a little bit about that tonight?
Sure. Well, thank you so much for having me. And I don't even know what the word is. I am so grateful that the National Baptist Convention is taking on this initiative, helping to address the condition of overweight and obesity in the African American community. It's a passion of mine because I have personal experience as well as about 20 years of professional experience. But you actually need me to talk about my story. I've had challenges with my weight more than half of the years that I've been alive. I was, and as a child, I carried a lot of extra weight. Didn't really think anything of it because it was pretty prevalent in my family, as it is in many African American families. But I didn't make the connections between the extra weight on our body and the chronic disease that was extremely prevalent in my family tree. If you hypertension, diabetes, heart disease, all of that, it was so common that I actually thought that it was like gray hair. Like when you got to a certain age, that this would automatically happen because that was just our environment. I got a wake up call when I was 17. I remember it was the first day of finals and my father passed away in his sleep. And I recall that my family kept saying over and over again, well, but daddy wasn't sick. What was wrong? Daddy wasn't sick. But when I looked at that, I came to realize that in my entire life, I started to discover this a couple of years later in my early 20s, that I don't ever really recall my father being well. We had gotten to a place in our family where we had normalized chronic disease. We had normalized having excess weight on our body. So many of these conditions were normalized that we didn't even realize that his health was in a bad place. Long story short, I started to look at my health and my weight, and I tried some of any and everything. And let me tell y'all, the struggle is real. It was I would lose 50 pounds and then gain 45, and then I lose 30. I mean, I went up and down, and probably over about 20 years, I think I gained and lost over 200 pounds, and that in about maybe 10 years or so, going back and forth. So much so that it actually damaged my health. In trying to make myself well, I was making myself sick because I was doing things that were not, I had to have my gallbladder cut out. I got to a point, y'all, where I actually just surrendered it. I was like, you know what? I'm tired of dealing with it. And that was when literally I decided to surrender it to God. And then I started to put some action behind this desire that was cultivated and customized for me. I literally started to discover what would be a path that would not only allow me to lose weight, but to be able to keep it off, not doing fads and trying all of these different things. And this is why I think this is so important, Dr. Miner, that we're doing this, because there's no one path for every person, right? And like, we are individual. We all have our individual, our biology, our ecology, our environment, our preferences, our lifestyle. Different people need different things. But I thank God that I was not only able to find the fit for me, but I also spent a decade working for the nation's leading weight loss company. I worked on as a national trainer. I helped develop programs and as in running operations for the states of Texas and Oklahoma. I have observed and have supported people, thousands of people in this journey. And in my organization now, I specifically do a science-based, faith-empowered approach to help Black people to realize, look at where we are, and to make changes that are effective and healthy and sustainable, so that we can align ourselves to be good stewards of our bodies and to improve our health as we're losing weight. So that's my story. I have academic experience, and I also have a lot of personal experience, and I have hard experience. And I just thank God and thank the National Baptist Convention and our sponsor as well for allowing us to be able to really work on this very important initiative.
Yes, big shout out to Novo Nordisk. All right. All right. Well, guess what? Wow. What a story. I like this. Healthy, effective, sustainable. I'm going to keep that in mind. Okay. All right. So I'm sure your personal story has some impact as you were designing this I Turn Obesity Around continuum. Would you kind of like provide us a high level overview of what this continuum is all about? And again, thank you to your company for allowing the National Baptist Convention to have use of this.
Thank you. Thank you. And as you mentioned, Dr. Miner, I'm going to pull this up on the screen, is that what we are doing is we're kicking off a series of webinars that will address a number of different aspects, because when it comes to managing your weight, to getting to a healthy weight and staying there and doing it in a healthy way, it is a multifaceted problem. So it takes a lot of different aspects that need to come together in the approach to address it. And so this framework, this is what we call our healthy weight loss that lasts framework. If you notice, it has a number of different elements that we will be unpacking and exploring over the next the series of webinars that are coming up. To kind of just give you the quick overview, as you suggested, at the bottom, you'll notice that it starts with awareness. We have to address this issue and begin to have some conversations that we really don't have, not only in the African American community, but also not in the Black church community. You started off by mentioning some very important statistics and data, but I want to add in a couple of other ones that go specifically to the Black church. When we look at Americans in general, the condition of overweight and obesity, together impacts 2 out of 3 adults. But when we get into the church, there's some research that finds that people that attend church regularly are 20% more likely to have the condition of overweight or obesity. So our prevalence and it increases. When we look at clergy, youth, the rates of overweight and obesity in the African American Christian community is greater than the general public. So I'm glad that we're having these conversations. Y'all, we have to go to awareness, because as a man thinketh, so is he. When we renew our minds, it has to start there before we can change our actions and our behaviors and take steps to get to a change. So we want to have those conversations. And so some of the webinars will talk about that. Things like our historical aspects, the cultural reasons, also some of the biological things that may be in place, and also how having extra weight to the point that we are in the clinically obese or overweight category, how that impacts our health. So we're going to do a lot of education, but education has to go forward. It has to be applied. The next step up, as you go there, it then goes to what is your why? This is where we are going to dig in and have each person that comes along on this journey with us to determine what is going to be your personal motivation, right? The reason for one person may not fit for another. And what a good why does is it empowers your action, right? So we want to dig into that and look at what are the personal reasons about why you're going to do that. And of course, we want to make sure that it's tied to our spiritual, our holistic living and our stewardship as well. I'm going to come on up a little bit more, and then we're going to talk about some of the actions that we can take as it relates to behavior modification. And if you'll notice, there are going to be a couple of different things that we're going to go into. Of course, we have to talk about nutrition. Sister Ellen is going to start to talk about that with us tonight, but it's a very important part. Of course, activity is a part. Rest, sleep, stress management. We're going to talk about a lot of those particular aspects as well. And then if you notice in this framework, there's this path where some people are able to, through a combination of those things, get to a healthy weight, right? But there are others. Oftentimes people need additional supports. They need medical interventions, be it pharmacology, be it medications or surgical interventions. If you need those to get to that place, we're going to talk about that. And I think that these are some conversations that need to be had a little bit more often, particularly in our community. And then that gets us to that place of where we have reached a healthy weight. But one of the things that we want to be really honest and truthful and realistic with is that it's not just about losing the weight, it's about maintaining, because sometimes relapse does happen. Sometimes we can find ourselves falling off because life happens, pandemics happen, things happen in our lives where we can have those shifts. And we want to talk about what happens that when we have to go back and revisit where our mind is, or remind ourselves of why this is important to us. When we have to go and make some shifts, maybe some things have happened in our personal life, our hormones, the stage of life that we're in. Where do we make these adjustments so that we can kind of be aware of where we are and know that there is a path for us to get back to where we need to be and how we can stay there? And then the last part, Dr. Miner, that I want to bring up about this particular framework that we have is that this framework and what keeps all of this together, because again, it is multifaceted, right? And it's not always easy. I'm going to be real with you as well there. But we want to also look at what are some of the underlying things that we as believers, as those of us who have to realize and remember that these bodies are not our own, they were bought with a price, right? That when we are caring for our bodies, it is an act of stewardship. We are taking care of the temple of the Holy Spirit. And I put on there also this aspect of surrender, because I know that this has been important in my life. Everyone that I kind of guide through this process through a faith empowered approach, we have probably tried some things before. We've tried to, willpower it and to just do these things using all of these real life type aspects. And of course we have to have those actions, but y'all, we have to make this a God thing. We have to surrender this to God, put it in his hands, and then do our part, right? There's that partnership there. We have to let God do the heavy lifting and give us that let Holy Spirit give us what we need to make these steps. And so that surrender aspect is very important. And then we also want to round that up with support. The support is not just, it's not all about our individual responsibility because we can't do this thing alone. We need the support of others. And we can also, as we have these webinar discussions, talk about additional supports, be they systematic, environmental supports, things that will help us to not only get there for ourselves individually, but to also put some things in place so that we can make some changes so that we are leaving a legacy. We're putting things forward where the generations that come after us will not have these same weight challenges. So those are the basics of the framework that we will be unpacking and going over and sharing with you all in the upcoming weeks. And we're really looking forward to just having a good time, finding out where we are, finding a path to get to our fit, and supporting one another along the path as we turn this obesity condition around in the National Baptist Convention.
Wow. That's my favorite word. Wow. I'm gonna dime on you. We were talking about this Monday night in our team meeting. We're trying to come up with something. I want you to know that this awesome woman of God, in 3 minutes, she had put together something on a napkin and got it together. That's how anointed she is. And she had this other stuff around it we got going. I just want to give a shout out to you from the fact that I've never seen anything that talks about weight loss and all this that tied in the medication part. I've always thought it's something separate. I like how the idea that pretty much wherever you are, you can find a spot. I like that. So was there any type of, was it based upon your experience? What kind of led you to kind of just, bridge the gap? Because most time I think about, I'm going to lose some weight, I'm going to change my diet. I never make the connection that they all are connected.
Yeah. Well, for me.
Excuse me.
Oh, I'm sorry.
No. I just wanted to let you know that you have a question.
Okay. All right. Finish it there, Sister Nanny, then we get to the question.
Just quickly, where does this come from? This particular framework has been informed not only from my personal experience, but again, y'all, literally in the work that I've done, and God, and it is a God thing. God me to have a career where I literally worked with thousands of people. I saw what worked, I saw what didn't work. I saw where the bridges were made, and I saw where there were gaps. And I also saw where sometimes there were things that people needed to help them to get there that we were resistant to kind of do. So literally, God positioned me to have these kind of experiences, and adding that to the academic study that can kind of help put it together so we can kind of curate and help people to find their individual fit in their path.
All right, excellent. All right, so Sister Copper, see, we had a question. I'm trying to, who was that person that had a question, Sister Copper? If not, we'll come back to that. Okay.
I'm asking, was it being recorded, Dr. Miner?
Yes, it's being recorded, and we will. It's actually right now on our we're live on our YouTube page, and it will be edited and be available for a premiere within the next few days.
Okay, and do you have scripture to go with your different pyramid levels also when the next webinar will be?
Absolutely. Apart from God, we can do nothing. And so this journey that we're taking is science-based, faith empowered. We're going to look, this thing is not easy. It is hard, but guess what? God helps us do hard things. And we cannot, nor should we, attempt to try to do this thing without him, and his word is speaking to us and gives us what we need. So definitely, this is a holistic path that we're going to be taking. So yes, sir. Yes, sir. Yes, sir.
And we've had some songs together, so we can maybe get Sister Ellen to sing a couple of them for us. Then go to, I can see I Surrender All. I can see all this stuff going on within everything. So we're already on with Christian Soldiers. We making this thing go. And look, fellow National Baptists, we are working with this as we going. So you're seeing history being made. Look, I got to ask this thing, this question, and I want y'all to zero in this. I love, Sister Nettie, about this on your thing, your why. I see the awareness. And the thing I like about your model, I always talk about going from awareness to the behavior modification. But you go from awareness to your why, then to the behavior modification. Can you really shed some light on, enlighten us on the points that power that your why?
Sure. Can I share from a personal experience?
Sure, certainly. Huh?
See, here's the thing. Awareness deals with our head, but our why goes to our heart.
Oh. Okay.
Let me tell you where this got into me when I was 17 years old. I shared a little bit earlier about when my father passed away. My daddy was one of 11 children. He was the eldest. And as I mentioned, these conditions were very prevalent in our family tree. And I mean, even my uncles, aunts, everybody, we had all these conditions. And my father was an educated man, right? He knew up here what was going on. He knew what was happening when the doctors would tell him this. And the same thing with all of his brothers and everything. The awareness was there, but it wasn't enough to take action. Y'all, when my daddy didn't wake up, when he did not wake up, I watched, and this was me as a 17-year-old young lady, I watched so many of my uncles that had conditions that weren't going to take their medication, they started taking their medication. I watched uncles that knew that they needed to change the way that they needed to eat. One of my uncles, who was Mr. Fry Daddy, he started learning how to smoke foods and how to bake foods. I watched them make some change because it went from being head knowledge to heart knowledge.
Okay.
And we get this thing down in here, and when our why is strong enough, it can answer some of those, but when and how and where. It can give us that empowerment. And I want to say this again, our why also has to be connected to God. When we connect that why to God too, and make sure that that's a part of it. And here I'm speaking again from my personal experience. And this is also why I made the move to switch to found my organization, is that we talk about God. It's a God thing. When about this, we have to make it a stewardship thing, and then find that personal aspect, because that's where our empowerment, that's where our strength comes. When we get sick and tired of doing some of the things that we need to do, or when we feel overwhelmed, that's where it comes in. A strong why can help us with some of those hard hows.
Woo! Wow.
I think you probably answered this question within those comments you just made about the impact of obesity on the effect of mental health.
So, Dr. Williams, would you like to speak to that?
The impact of obesity on mental health, we see it across the spectrum, with our children who suffer with overweight and obesity, bullying and harassment in school. We see it as an adult, where we see that individuals who have overweight and obesity are less likely to be hired, found to have perceptions of their not being as effective or having lower ability than others. It can lead to anxiety, depression, isolation, all because of suffering with overweight and obesity, and what we as a society, even as healthcare providers, and how we talk about it, and using negative terms to talk about a condition that is chronic and not caused by one singular aspect of our lives. So yes, it has so many factors in how it affects us beyond our health.
All right. Thank you there, Dr. Williams. All right. Well, look, Sister Crocker asked about the behavior modification. We're going to go into that now. Sister Nettie's going to do part 1, and Sister Ellen's going to do part 2. All right. So, all right. So we go up this pyramid and we're looking at this thing about behavior modification. All right. Would you share? So I got the little thing here that you sketched out. I'm probably going to frame this thing and keep this for posterity. Behavior modification. You have on here this exercise part. Would you give us some feedback? And Sister Crocker, we're going to answer this in between both of them to get that taken care of for you. Okay, so it's exercise, behavior modification.
God made our bodies to move, right? God made our bodies to move. And we live extremely sedentary lives. I think that during this COVID condition, where most of us are spending a lot of our time on Zoom and we're sitting down, I think even more so, when we have movement, it definitely can help our health, and it can help as it relates to weight management. So because we just have a certain amount of time here, I'm just want to just kind of outline that we will be talking about finding your fit. I'm going to say that over and over again as it relates to exercise. What works for some people may not work for others. What we may have been able to do in our 20s may not be a fit in our 50s, right? We have to find something that is going to be effective, safe, and something that we can do with consistency. So we had a program in the National Baptist Convention a couple of months ago called Let's Move National Baptist. What we're going to do is we will have an aspect where we will talk about the different types of exercise, cardiovascular, muscle toning, strengthening, balance, all of these types of things. And we're going to guide people to resources to help them find something that will fit in their lives so that as we are, being consistent and having progression, it can help us to not only lose weight, but to also maintain it, and also for general health, for our general overall health. So we're gonna dig into that exercise piece in the upcoming weeks. All
right. Well, look, hopefully we'll get you off in just a minute, Sister Nettie, but we have Dr. Bostic wants to know what's the plan to get this into our churches and out to the community? Is this gonna be part of our Let's Move National Baptist paradigm? How are we gonna see that, make that happen?
How are we going to make what happen? I'm sorry.
I make this plan, turn obesity around, get into our churches and into the communities our churches serve.
Well, the start of it is this, as Dr. Michael said, this history-making webinar that we're having here today. And what additional webinars will be coming up in the series that will have resources, workbooks. Will be pointing you to existing resources. You don't have to reinvent the wheel all the time as well. But as we're guiding it through, what we really are encouraging, and y'all, I'm gonna be honest, what we need for the everybody that is part of this, is on this call, start to share in the churches. We are providing the resources, the guidance, the opportunity to come together and to have some of these discussions, to do some of these explorations. But we really do need the individual churches, members in the churches, to share within your health ministry. If you don't have a health ministry, we have hope. We can help you with that. If you don't already have one, and also to just share in your families and in your community. So we're going to provide the resources, and these webinars are going to be our hub of sharing, and you'll get workbooks, handouts, things like that as we go forward.
All right, thank you. All right, what about rest and stress, or is it stress and rest, or is it rest and stress management, or is it something? What is it? What about that? How to do it with behavior modification?
Both of them, they are extremely important. Y'all, let's not sleep on the importance of good sleep. Sleep is extremely important. That time of inactivity is actually very active. It's a time when our body is repairing and resetting, and hormones and all of that. If you don't get sufficient sleep, it can also impact our weight management as well as our overall health. So we're going to be talking about not only, good sleep hygiene and how to make sure that we're getting good sleep. And when we have conditions of overweight and obesity, sleep becomes, for many people, more of a challenge as well. But we also talk about stress management. Stress is another one of those aspects. As Dr. Williams was talking earlier about, some of the mental health aspects, stress does affect some of our hormone levels that definitely directly impact fat gain, fat maintenance, and fat loss. So it's important for us to look at that stress factor as well. And I want to throw one other thing into modification, and it also goes under awareness. We also want to talk about some of this stuff that's going on in our head as far as our cultural biases that we personally have. of these things that prevent us from taking steps to manage our weight. And I'm just gonna go there really quickly. For the
Okay.
on the call, sisters, how many of us grew up hearing, don't no man like bones, only dogs like bones. You gotta have, I don't want, can we just be real?
You want somebody to hold on to.
Come on. And how many times have we even said things like, well, my man likes me a little bit. We gotta have some of these conversations.
Right.
Some of these kinds of issues that
Yeah. Wow.
this act. I'm done. Let's
Hey,
go.
look,
I'm done.
yeah, I've even said it a couple times myself. Yeah, okay.
And Dr. Minor, she really touches on a very important point in
Here we go.
that,
Come on, we bring you back here. Okay.
in
All right.
that
Go
the
ahead.
discussion of overweight and obesity is such a complex topic. Even from our childhoods, it's our environment, it's our culture. There are social determinants that drives our stress up. There are lack of access to healthy foods, as Sister Ellen, I'm sure, will share with us. And we live in this obesogenic environment. Such as Sister Nettie said, we normalize obesity, we normalize chronic illness. So many of our family members have diabetes. We think like it's like God ordained that it's going to happen. So it's a very complex discussion that we're having here, and I'm super excited about the continuation of it.
All right, wonderful, wonderful. All right, well, Sister Nettie, we thank you for this first part, but we got to go on to the next part about modifications because it's quarter of the hour, but we're going to bring on our very wonderful Ellen McKnight. Okay, all right, we're going to bring you up here. All right, and I want to thank Sister Ellen is always working hard. She jumped off one webinar where she's making $1 billion to come in and do this as a thing for her denomination. I just want to give you a shout out. A lot of younger people don't have that type of love for their convention. So thank you, Sister Ellen.
Thank you, Dr.
All right. So look. All right, I got some things to ask about you. First of all, real quick, I try to do justice to it, but can you just give a little tidbit about the Maxine firm that maybe I didn't touch on, and how this thing about what you do in nutrition, and you've been on the TVs and things and all this and other stuff and podcasts and all of that. Just a little something about that, a little something.
Thank you so much, Dr. Minor. As he already said, my name is Ellen McKnight. My background is in human nutrition and dietetics and agricultural science. And then I work in the public health space as well. And what our firm has the opportunity to do, we are made up of a network of minority healthcare professionals. So it's myself, a family nurse practitioner, primary care provider, licensed clinical psychologist, and a horticulturalist. And what we have the opportunity to do is travel across rural and urban communities across the state of Louisiana and the Deep South to provide culturally appropriate health education, nutrition, and literacy programming to youth and adults in rural and urban communities. And so, Sister Nettie and Dr. Labora Williams hit some really high points as it relates to some of the root causes of obesity, and it really starts with mindset. And so when Sister Nettie talked about that why in between awareness and behavior modification, that hit me down in my shondo, because if you can't get to the why, we'll never get there. But anywho, that's the work that we do, and we enjoy doing it in a faith-based setting. We have corporate clients and things of that nature, municipal, so on and so forth. But I was drawn to I was already a member of National Baptist, but I was drawn to the Hope Ministry, the National Baptist Ministry, because I saw on Twitter that there was a pastor who said, I will no longer be serving fried chicken in my church. And I was like, who is this man? And so when I saw that, looked him up and found out that, this is a whole entity that was doing work around transforming cultures and conversations around wellness in the National Baptist Convention. So, I'm proud of the work, and that's why I am a part of it. And I got to meet Sister Nettie Johnson, who was doing the work in Louisiana. That just goes to show you that, it's just important that folks continue to have these conversations so that we can, band together and work together, because it's a big problem. So we need lots of folks.
And look, everybody, y'all be on the countdown. We'll let y'all know down in the future about. She thought I'm gonna say something else. I'm talking about your doctorate. That's on the way, and she's on the way and everything. We're gonna help her. We're gonna help her along the way. Dr. Williams and I already been down that path. We got you. We got you. We got you. We can review some stuff. All right, I got some questions, more questions for you here. Okay. Now we see that you're more than qualified to talk about nutrition. Now, what role does nutrition play in this continuum that we're about to develop?
So nutrition is huge. Sister Nettie has talked about this equation that she likes to share when we present, but nutrition, when it relates to obesity and weight loss and weight management, a lot of times folks might forget about nutrition. Well, and in essence, oftentimes it can be 80% nutrition and 20% physical activity. And, that just depends. That's not specific to every person, but it's in a broader sense. And so it's really, really important that we are mindful about the things that we put in our bodies, because those chronic diseases that we've been mentioning, overweight, obesity, heart disease, type 2 diabetes, hypercholesteremia, kidney disease, hypertension are all preventable diseases. And it has everything to do with what we put in our temple and our daily practices. So it has a huge, inputs affect outputs. Dr. Sister Nettie already mentioned that our bodies are temples of the Holy Spirit. And so we want to encourage folks to consume foods in its most natural state, and or in the way closest to what God intended them to be.
Wow, hold up. You said something there now. I want y'all to grab it. She said in its natural state. So we eat food in unnatural states?
Sometimes we do. And so when I talk about eating foods in their most natural state, I'm talking about whole foods, not the store, but I'm talking about, we like whole foods, but I'm not talking about the store. I'm talking about foods in their fresh foods, whole foods, foods that have not been processed, foods that have not been genetically modified, foods so one of the rule of thumbs that I like to encourage folks to ask themselves, hey, before I put this in my body, right? Did it grow out of the ground? Can I pick this off of a vine? Did it grow on a tree? Or was it made in a manufacturing plant? These are some of the things that you want to ask yourself. And then, at the core, and when you ask yourself those series of questions, it's like, hey, is this real food? So if we intend to operate at optimum capacity, we have to put good things in our temple in order to yield good results. So it's kind of like that, Dr. Minor, I'm sure he has a Maserati, and he has, I'm just playing, but you know what I'm saying? All the guys, they like the fancy cars. And if you are driving a fancy car, our bodies are fancy cars, and that fancy car needs premium gas. We cannot be riding around here in these fancy cars, putting regular gas in them, because they're going to let us down. Same thing goes with our body. So.
Wow. I love that. You know what? I'm so used to driving my plain old car. When I finally got me a luxury car, you ain't never lied. I'm used to putting that little regular. It's a hold up. So when you get that luxury car, you got to treat that for some luxury. I like that. We're going to borrow them. But look, since you talked about that, why are we so addicted to salt and sugar?
Oh, that's a good question. Why are we so addicted to salt and sugar? I mean, so there's a number of reasons. It has a lot to do with upbringing and how you train your taste buds. You can literally train your taste buds. For example, some examples, some cultures have never had a cold drink or soda or pop, depending on what region you're in, ever in their lives, right? And then there are times, think about, we're from the South and we drink sweet tea, but there's a range or a spectrum to that, right? So sometimes, you know, to one person, the tea might be too sweet. To the next person, the tea is not sweet enough. You know what I'm saying? So that has a lot to do with what patterns that you've developed throughout childhood. I have some friends whose children, they don't give them sweets. They don't give them candy. They don't give them processed foods. They don't experience McDonald's. And so,
What?
you know, right?
No Big Mac.
No Big Mac, but those children, whenever they get to high school or college, their taste buds are going to be completely different than a child who was raised up on chicken nuggets, who was no shade on
Gotcha.
chicken nuggets, but you know, who was raised up on, you know, a whole bunch of juice and things like that, because our taste buds develop differently, and that's also cultural. Now, you know, from a scientific standpoint, we know that like eating excess sugar, especially added sugars, you know, that releases like neurotransmitters in our mind. So dopamine, so that's like a reward system, right? In your mind. And so it's addictive, almost like, you know, drugs, right? And so, you know, you're on a high, but that only lasts for so long, especially if it's an added sugar, because you're going to experience a crash. Now, we know that, you know, that's directly linked to added sugars. And there is some research that indicates that for sodium as well, but we know for sugar for sure that this happens. And so, you know, it's just really, really important from the onset. I know that's why childhood obesity is so prevalent, but it's in child nutrition is so important. But these practices have to be implemented at an early age so we can train our taste buds, we can train our minds, we can train our palates around what's important, what's healthy for us to eat, and what's appropriate and what's beneficial to our bodies in the long term.
All right. Well, look, you got a question here from Sister Gerald Wood. Says, with FDA not always having companies labeled GMOs, how we know if you are eating something that is not GMO?
With FDA, what?
So with the FDA not always having companies labeled GMOs, how we know if you are eating something that is not GMO?
That's a really great question, because the same thing with organic foods.
No problem. We understand.
The same thing it's the same thing with organic foods. You know, oftentimes a food can be labeled organic, but it's not necessarily organic. What am I saying? It's very, very important to try to consume food. If you're interested in making certain that you are eating foods that are not genetically modified organisms, that's what GMO stands for. It's important that you either grow the food yourself, or that you try to shop locally, or just ask the grocer, or ask the grocer that you purchase your food from, hey, you know, like, who's the manufacturer? Where is this coming from? Is this truly, or is it truly, is this or is not this not a genetically modified organism? Has this food been, where was it grown? How was it grown? So you have to ask those questions, but there is no real way for us to monitor the federal government, the FDA at this point around that. Because it's just not tight. The restrictions are not tight. And so the only way you know is if you grow it yourself, or you know the grower, or again, if you shop local. So, yeah.
Now, look, everybody, we're about to run over our hour's time, but part is because we're trying to ask all y'all's questions and everything that we have. Look, let me just get to this. So, look, y'all just hang with us for another 20 minutes or so. It will be done. But we have to ask this question. Now, in your efforts, I know you've seen those who are like cars on bad gas, Sister Ellen. They start and stop. Is there a health danger in the so-called yo-yo dieting, the start and stopping? If so, would you explain with them?
Oh, okay. So yo-yo diet, y'all, diets don't work. Okay, so like diets don't work, lifestyle changes do. So it's all about making lifestyle changes that you can implement over a sustainable changes that you can implement over a lifetime. Okay, so those really strict diets that operate out of restriction, that's not what the Lord desires for your life. Okay, unless you have, you know, instructions from Dr. Williams, or, you know, your primary care provider or a specialist, and so on and so forth, that those lemonade diets, paleo diets, keto diets, that That does not work over a long period of time. So instead of starting and stopping and starting and stopping and causing and putting your body in a state of shock and also your strain on your internal organs, it's really, really important to make certain that you are eating a balanced diet, okay, but, you know, and a variety of foods. I always tell folks just to make certain that their plate is colorful.
Okay. Oh, I was waiting for it. There it is. It was somewhere nearby.
Make certain that their plate is colorful, because the reality of the situation is, as long as their plate is colorful, different colors offer your body different vitamins and minerals. Red foods, lycopene for prostate cancer. Blue foods, purple foods, high in antioxidants and help fight free radicals in your body that cause cancer. 9 times out of 10, if everything on that plate is brown, yellow, or orange, it's either high in fat, high in sodium, or high in added sugar.
Woo! Lord, now mercy. Well, that I tell you, we're just blessed to have her part of what we're doing. Don't look. Come on, y'all need to get a little clap rating now. We got some awesome panelists, and they are good National Baptists. Okay. All right. Wait a minute. Anonymous attendee asks, is there a daily amount of salt needed?
That's a good question. That varies from person to person, especially as it relates to physical activity. If you're expelling a whole bunch of sweat and things like that, you know, Cincinnati can attest to that. However, the American Heart Association recommends that no more than 2,300 milligrams of sodium if you intake that. So no more than 20. The American Heart Association recommends that the average healthy American does not intake more than 2,300 milligrams of salt a day. How do you monitor that? Read your food label, check the serving sizes. It's really important. Now, that's the healthy American. If you're on high blood pressure medicine, the recommendation is between 1,400 and 1,800 milligrams for the day. Okay, so 2,300 if you're not on under 2,300 milligrams of sodium, if you're not on high blood pressure medicine, and if you are on high blood pressure medicine, between 1,400 and 1,800 milligrams of sodium a day.
All right. Well, look, somebody else asked, do you encourage SOS free whole food based vegan eating styles? What is it? I guess it's about vegan. Vegan eating style.
Vegan. Yeah. So Sister Nettie Johnson has a book called Veganish, and it's a super awesome cookbook. What'd you say, Dr. Miner?
No, I'm hearing you.
Okay, it's a super awesome.
Because you just did a webinar on veganism, but maybe think about that when you said that.
Okay.
You did a webinar on veganism this week. Go ahead.
Yes. So it's a super awesome cookbook. But here's the thing: what we don't want you to get caught up on, are those. I don't want you to go to the store and buy a product just because it said vegan on it. Reason being is because we understand that the vegan lifestyle right now is popping, is hot. Folks are putting vegan and gluten-free on anything because it's selling, okay? And it's because folks are trying to live healthier lifestyles. That is great. But what we want you to be mindful of is the sodium and the sugar on a product, even if it says it's vegan, okay? Because a lot of times it may not have any meat in the product, but they might have substitutes in their product to make up for taste, all right? So in this cookbook, the cookbook has whole foods, real foods in this cookbook, okay, guys? So I want you to kind of focus, not necessarily on the word vegan. I want you to focus on whole foods and different colors and a balanced diet.
All right. Thank you, Sister Ellen. All right. Thank you. All right. We're going to go up here and we're going to bring in Dr. Williams because we started moving up this pyramid because good seeing you again there, Dr. Williams. All right. Well, I think we kind of touched on all the things about the consequences of obesity. We've done that. Yeah. All right. So look, you educated me on this. Okay. Some people who want to do better, they just don't want to do better because for whatever, it's a death sentence if they don't do anything different. Why do so many people suffer from obesity have problem losing and or keeping the weight off?
Dr. Miner, because of all of the things that we've discussed tonight, again, we live in an obesogenic environment. Obesity has become such a part of our lifestyle and so normalized in our society that we don't see it as the chronic condition that it is.
Okay.
And secondly, when we do make up our mind to change, it's hard. It's hard to lose weight. It's hard to keep it off. And when we live in a society that makes it even harder, then for some people with their minds, they begin to believe that they cannot. And they try fat diets and other things that are not healthy, things that they cannot sustain. So it becomes even a greater challenge until they interface with people like Sister Ellen and Sister Nettie.
Ah, I got you. I got you. I got you. So then, as we look at on the little chart that Sister Nettie showed us, so then there are some people then that behavioral modification won't work. So what are some things that we have to look at to help people that behavior modification just doesn't do it, doesn't cut it?
Well, I think, Dr. Miner, that it's very clear in the literature that behavior modification is first. So people will try to make those adaptations in their lifestyle. So not a diet, as Sister Ellen explained, but a lifestyle change, a healthy diet.
Okay.
If those things fail and the individual is committed, as Sister Nettie said, their mind is made up that they want to change their lifestyle. With the commitment, fail in lifestyle modification, medications and surgery sometimes are indicated, but it never takes the place of healthy nutrition because our bodies have to have healthy nutrition. It never takes the place of physical activity because, as Sister Nettie stated, our bodies need to move. But there is a place in the continuum for medications and surgery if necessary.
Okay. So how does medication work in combating obesity?
Well, right now there are about 4 medications on the market to treat obesity and overweight. Generally speaking, some of them work by inhibiting the fat absorption of our bodies.
Okay.
Others work by changing the serotonin levels of our bodies. Some work by increasing our feeling of fullness or decreasing our appetite.
Wow, I did not know that. You just say you learning me something tonight. Okay. Well, so are these things that we have to, obviously we can't get them over the counter. We have to work with our health professional and getting that done?
Absolutely, Dr. Miner. And these medications are indicated for individuals who are morbid obese, not someone who's between 25 and 30, so overweight to obese, but people who are morbidly obese, 30 to 35 BMI, or people with lower BMIs, but with chronic medical conditions where they need an intervention beyond lifestyle modification.
All right, I'm going to shout out to Sister Nettie again, because this is the first model I've seen that we work with that actually has a connection that has the medication there. But what about the surgery part? What can we say about the surgery?
The surgery indications are very similar to the medications for individuals who are committed to lifestyle change, committed to wanting to lose or maintain their weight loss, who are committed also to lifestyle modification, who have taken medications and perhaps failed. Many of the medications on the market are for short-term interventions for 3 to 4 months. And if an individual has tried those things and their BMI is still high in the morbid obesity range, or they have chronic medical conditions in addition to morbid obesity, then surgery is indicated.
Okay. So if I got this correct, so I think I've always been, until I started getting involved in the National Baptist, we cannot just preach a diet and exercise only program.
We cannot, Dr. Miner. Everything that we tell our patients as clinicians, when the patient comes in and they suffer with overweight or obesity, and we say, oh, well, you need to change your diet. You need to be more physically active. They've heard those things. They've tried them before, and it didn't work for them. So the individual needs support. Obesity is a chronic medical condition. It's not a one size, one pill fits all condition. And it takes multiple modalities sometimes to affect change with it.
Wow. So multiple modalities. So wow. Get another South Cincinnati by getting that lined up for him. So really, it's like we need to change the conversation about how we for obesity.
Well, we need to build on the conversation.
Okay, Bill.
We
Okay.
can't get aside of healthy nutrition, physical activity, but it's more than that.
Okay. All right. So if I got this right, and you correct me, Dr. LaVoy, sometimes I get off in left field and outside the ballpark. So it feels that the thing that Sister Nettie has developed for us captures a continuum.
Absolutely.
Right. So wherever you are, you can find your place.
Yes.
Love it. Love it. As a former math major, I like stuff like that. Okay. All right. Wonderful. Let me bring all our panelists back up. We got some more questions that's come up here in the chat. Let me add the spotlight. Okay. Sister Crocker, let me allow you to. Sister Crocker, you had a question you wanted to ask the panel. Sister Crocker? Just unmute your mic, Sister Crocker. Or did she put in the chat? Hold on, wait it. My bad. She just put in the chat. After changing eating styles, is it true that diabetes can be reversed? Okay.
There is some evidence to suggest with bariatric surgery, once the surgery, a person has gone through the surgery, their diabetes can be reversed. And there is some evidence to suggest that with fasting and certain diets, that an individual can reverse their diabetes.
Okay.
Yes, Sister Crocker, did you get that? That was your answer to your question, Sister Crocker?
Yes, it did. Thank you.
You're welcome.
All right. So Florine Cunningham, when buying salt, should it be with iodine or without? Hey, nobody wants to answer.
I was trying to read what Sister Nettie put in the chat. Could you tell me again what was the question for me?
Well, I just put it out there for whoever y'all got, one of y'all panelists. Should it be with iodine? As you buy salt, should it be with iodine or without?
Yeah. So iodine has been added to salt because of the Goiter's disease, and so if you're buying salt, salt with iodine is fine, even though we don't have Goiter's disease anymore because we've gone past that. Essentially, researchers will say salt is salt. There are some salts that folks swear by they're better than others, like the sea salt or the pink Himalayan salt, or nobody's here with the umbrella lady anymore with the iodine in it. But the whole point of that is those salts, the pink Himalayan salt and the sea salt, they're lower in higher in trace minerals and lower in sodium, but just by a little bit. The whole point is you want to have salt in moderation, but yeah.
Okay.
If you have a condition that iodine that is affected by iodine, you definitely want to talk to your endocrinologist and your primary care provider, and then a registered clinical dietitian if you have a condition as relates to iodine. But typically, it's safe for most healthy Americans.
Okay. All right, and I gotta just say this about salt. I was trying to be healthy, and I cut back on salt. Another thing that I was having, but for some conditions that I had, I went to the doctor, and he told me I was killing myself. So what do you mean I'm killing myself? So where you are, you don't have enough sodium in your diet. And because what I have, he told me to put extra sodium in what I'm doing. And you know what? After I started doing it, I felt better. I said that because you have to know your body and work with your health professional. As I always say, what can help you will kill me. Case in point, somebody was saying, you need to eat some more nuts. I was like, hold up. Because some people are, I just want to put that out there to share. Okay. All right. So Anna Emanuel says whole food vegan is different than vegan. Whole food is not processed food. So
what's the question?
That was just a comment she had out there. Whole food vegan is different than vegan. Whole food is not processed food. So.
Oh, I think she was echoing what Sister Nettie Johnson and I were saying about whole foods and eating them in a whole form,
Okay.
not processed, not manufactured. So yes, ma'am, you are correct.
Okay. All right, Ms. Sophia Carr. We know that many families live in areas where they are able to attain fresh vegetables, food desert. All right, how do we change their diets to reduce obesity when they are unable to obtain fresh fruits and vegetables daily? Let me throw another one in. And even if you do have it over there, they can't cook it. But go ahead. What's your response?
Ooh, so Dr. Laura Williams mentioned all the different contributing factors. I see she stood up in her seat.
Well,
Go ahead, Dr. Williams.
I was going to address that by saying policy implementation. We're working here in Lexington, Kentucky, where we're trying to implement in the corner stores a small refrigerator so that people can get fresh fruits and vegetables from their corner stores, because corner stores are ubiquitous, but yet the Kroger and the giant grocery stores are sometimes 3 to 5 miles away from inner city neighborhoods. So people are challenged by simply getting fresh fruit and vegetables. Bringing farmers markets to the neighborhoods instead of the individuals having to go to the farmers market, which is oftentimes on the outer areas of the town or right downtown in the city.
Hint, hint, pastors that are listening and state convention presidents, your parking lots will make great places for farmers markets.
Absolutely.
Yes, Sister Nettie.
I want to add a part onto that. Dr. Williams, you're so right. We do have to stand up and make some noise and make some demands that the infrastructure and the environment in many of the communities, particularly African-American communities that are having economic issues, that there are some changes that are made there. But I want to also put another piece out where I want us to also look at, from, in addition, in parallel to the systematic and infrastructure changes, we also have to come back to this mindset, because I'm going to be honest with you. Even when access is not an issue, we still have in our community too many folks riding in luxury cars access that still don't eat well.
Yes.
I have seen personally, I'm very involved in the community as Sister Ellen is here in Baton Rouge. I have seen instances where they have set up farmers markets in church parking lots and they've closed them because people didn't come. And I've also seen where when Krispy Kreme reopened after being closed for an entire year, the line was down the street. And people at 4 o'clock in the morning.
Wow.
I have seen long lines. Can we be real? Because if we're not being real, I'm not just access issues, but if access was a major was the largest determining factor, then people that have access would not have these weight conditions, would not have these chronic disease conditions. But in our community, we see it across the board. So certainly we have to continue to push the advocacy and the access and the environmental issues, but we also have to address the cultural issues that are in place, because like we said, it is a much more complex issue. It is complex. And we have to start having some of those conversations to look at that. Sister Ellen, in her firm, they have somebody that helps with gardens. Think about our grandparents. They would go out in the yard and grow some stuff. Do you know what I'm saying? So these are some of the shifts that we have to start really examining and looking at in our culture, and look at what is and why it is that way. And then we have to draw a line in the sand to say, we're not going to allow this to be strongholds anymore. Let's help one another where we need help, but let's also look at it and let's kind of call a spade a spade.
Also,
well, since Sister Nettie has opened the door, she is absolutely correct, because there are lots of, I spend most of my time in urban communities because I'm interested in, reaching folks that look like you and I. And our health has to be important to us. Okay, we have to decide to command our health. And there are true access issues, but here's the thing: in those same communities where there are access issues, for a lot of these communities, we order what we want. we'll go to another side of town to get what we want, even if transportation is limited. If it's important to us, if it's a priority to us, we'll find a way. We will, even if it's an access issue or transportation issue, we'll make sure our nails are done. Even if it's an access issue or transportation issue, we will order some hair from offline. And you can order fresh fruits and vegetables to come to your house with CSA programs. Even if it's an access issue or transportation issues, we're in line across town for Jordans because of systematic racism. There is no mall on our side of town. So we have to get really, really, really serious about commanding our own health, because if we don't, there are several organizations that profit from our lack of knowledge and our lack of discipline, financially profit. So y'all are right.
All right. Wow. All right. Well, look, so I just want to, okay, so Sister Teresa Fails says, Dr. William, how do you feel about metformin for weight loss, 90 plus pounds, but no diabetes?
How do I feel about it? As we stated, there's a place for pharmacological interventions for weight management.
Okay. Well, then Gerald Wood asks, what are the side effects as it relates to already comorbidity?
What are the side effects of?
As it relates to already being comorbidity. I guess if you're already really, really up there.
In weight? What are the complications of obesity?
I guess I would say so.
Well, the complications of obesity are, as Sister Nettie and Sister Ellen stated earlier, high blood pressure, diabetes, cancers, specifically breast cancer, colon cancer. Even with the recent COVID-19 pandemic, we're seeing that people who are overweight and obesity are more likely to have mortality, to die from COVID-19 or become seriously ill than people who are normal weight. So obesity, although it's prevalent in our society, it has many complications that we have to take charge of our health to address through lifestyle interventions, medications, surgery, access issues, overcoming them.
The continuum.
The whole continuum, absolutely. Absolutely. We are not going to solve obesity in one conversation. It is such a complex subject.
Okay. All right. Well, Ricky McCauley asked, how do we work through the cost of making lifestyle changes?
How do we work through the cost?
Make the cost. Some people assume that you try to, I guess I'm thinking here that if you want to eat healthier, other type of stuff, it costs more. That's all I think of, the cost of making lifestyle changes. Yes, Ellen, you were trying to say something. Go ahead, Ellen.
I saw Sister Nettie's hand move, so I thought she was about to say something. I was going to wait till she said something. Okay. How do we work through the cost? That's a really good question. And on the practical side, in essence, if we plan ahead as it relates to our diet, as it relates to the things that we eat throughout the week, we will spend less money if we plan our meals out ahead of time. And so the rub comes, people like, I don't know what to eat. I don't know what to, and that's when you seek out references. There's cookbooks, there are healthy recipes online. You can go to the American Heart Association, the American Diabetes Association, and there are a slew of free resources that help you plan out your meals so that they're healthy. When you plan out your meals so that they're healthy a week in advance, and when you do your grocery shopping a week in advance, it will drive down some of the costs. Now, I will say that if we don't make an investment in our own health on the front end, we will pay for it on the back end in hospital stays, in loss of life, funeral costs, caskets, digging the grave, fighting over who's going to print the programs.
Lord, help us.
Things. Color. Black and white. So what am I saying? We have to make some investments in our own health on the front end, or we will have to pay for it on the back end with our time or our lives. So.
Absolutely.
And there's also an opportunity, particularly for churches to and health ministries, to bridge the gap by making sure that individuals are informed about resources that are available that often are not used. For example, there are in our area programs where if you receive SNAP benefits and if you go to and purchase whole foods, like Sister Ellen was saying, fruits and vegetables. If you come to a farmer's market, you can spend $10 on your SNAP benefit to get $20 worth of vegetables. A lot of people don't know that, right? So there are resources and things that are available sometimes that can help with that. And part of what we really want our health ministries to do is be part of that resource connection, where we take people, be that bridge of information between people that have needs and organizations, programs that are out there meeting those needs as well.
Right. Dr.
Okay.
Williams, you're at the University of Kentucky.
Yes.
Is that the land grant institution? The 1862? Okay, so there are land grant institutions and HBCU 1890 land grant institutions all over the country, and they have extension programs. They have farmers markets. They have these resources that Sister Nettie is talking about. So if you want to grow your own garden, they have resources that can equip you with the materials, with the seedlings, to help and the instructions to grow your own food. They also have nutrition education programs where they show you how to purchase and prepare and plan for your food. And this is a free resource. So if you are find the one of the resources, you can find the closest extension office to you, and they can help in that space, in that area. I'm sorry, Dr. Minor, go ahead.
No problem. We're trying to wrap things up. We know we run over. We're going to answer the last few questions in our chat. We also want to remind you that our next webinar will be for the Southeast region. Will be Thursday, May 20th. That's Southeast region, Thursday, May 20th at 8 p.m. Eastern, 7 o'clock Central. That'll be for the Southeast region. The next one coming up. And we will also remind everyone that each one of these webinars, we're going to talk about the continuum. We're going to talk about everything we're going to have a specific emphasis area, but we want to remind everyone of all the components where you fit in. All right, here we go. We'll run down this. Now, look, if I don't answer your question, that means that when I said this was it, you added yours later, okay? All right, K.R. Allen, I'm interested in plant-based and intermittent fasting. Please advise. Also, is an alkaline diet beneficial? Okay.
So I heard.
I'm interested in plant-based and intermittent fasting. Please advise. Also, is an alkaline diet beneficial?
Okay, so an alkaline diet, you're talking about making certain that you eat foods that are like keep your body based, because cancer and things like that thrive in acidic environments. I understand what you're saying there. And then also with the intermittent fasting, not eating for 12 hours and then eating for a short period of time. I just understand what you're saying there as well. For both of those, you need to consult with your primary care physician, and you also need to consult with a clinical registered dietitian to pull your blood panel. And because there are some folks who cannot intermittent fast because of certain medications that they may be on. And then also with the alkaline diet, there's not the research. You definitely want to consult with your primary care physician before you make those are restrictive diets, and you have to be in a place, your body has to be healthy enough for you to engage in a restrictive diet like that. And you said the plant-based. All things plant-based are great. Like, you're on the good foot right there. So if you're interested in, being more plant-based, that's awesome. That's going to, 9 times out of 10, that's going to keep you out of cancer alley, or, it's going to, you won't have to deal with as much obesity and overweight, hypertension, all of that. So the other two, consult with your primary care provider and your specialist and your registered dietitian. And then also with the plant-based, that's all great.
All right. What about frozen vegetables?
That's great. Frozen vegetables are great. There's a hierarchy to vegetables. First, you want them fresh as you possibly can. If you're not fresh or locally grown or from a farmer's market, Sister Nettie and Sister Williams mentioned, you want to go with the frozen route. Essentially, they pre-cook them and they blanch them for their color, and then they package them. So, frozen vegetables, that's a good option. They still have nutrients in them. And if you don't have access to frozen vegetables, the next option is canned. If we do canned, and I want us to just be mindful of this, because we do a lot of canned green beans in the church, you want to make certain that that can says no salt added, because we said we need to stay under 2,300 milligrams a day of sodium. And if you're on high blood pressure medicine, 14 to 1,800 milligrams. But that's a great question. Frozen is okay.
Wow, you talking about the black repast meal now? The beans, the canned corn, and the fried chicken.
That's the issue, Doc. Uncle has died of a heart attack. And when we go to the repast, we have heart attack in a to-go pot for you and the family.
And we bring it to the house.
Okay, awesome. All right, here's the next one. So Joyce just asked, is there a benefit in consuming the blue and yellow packs instead of sugar?
Oh, you're talking about aspartame?
Yeah.
Okay, so the yellow pack is Splenda. The blue pack is the equal. Okay, so remember at the beginning of this conversation, we talked about we wanted to consume, those are artificial sweeteners, and the whole idea about those is that you need less of them because they're 100 times more sweeter than the original sugar, like the brown sugar or the white sugar. So here's the thing with that: if you are a type 2 diabetic, you want to consult with your endocrinologist and your registered dietitian about that. But for the average healthy American, research indicates now, because nutrition is ever evolving, that if you are consuming sugar, you want to consume it in its most natural form. A lot of folks recommend brown sugar or honey, especially honey, because it's antimicrobial.
All right, we got the last two questions here. All right. Sister Nettie mentioned individuals that attend church have a higher risk of being obese. Please expound. Thanks.
Yes, well, there was some data that looked at overweight and obesity in the church. And they found that not only are regular churchgoers 20% more likely to be overweight or obese, they also have higher rates of high blood pressure and cholesterol than individuals that do not attend church. But y'all, when we ask about where does this come from, there was also data in that study that found that 76% of pastors are overweight or obese.
Oh, we know that. That's because y'all feed us too much. The preacher plate.
Attend Bible study and attend church more likely are more than 50% likely to be obese. And this, again, is such a multifaceted kind of issue. I mean, we can even take it back. If you look at the history of the church and how it went through different modes, there was this mode in the early church where caring for your body wasn't even considered something. It was actually considered to be a not so spiritual thing. If we go back really far back into early Christianity, I personally believe that when we look at the Black church, we have been taught an overall theology, and I'm talking about a perversion of the liberating theology that is the truth of the gospel, right? That taught us to be fine with suffering here because everything's gonna be better in the Bible.
Wow.
And
wow.
Also apply to our health. Now, I want to say this: when people have been denied something for so long, we have been denied access to good health care. We were deliberately, our ancestors were fed the foods that were the scraps, and God in his graciousness allowed our ancestors to not only survive and thrive on that. Think about it, the chitlins, the scrap pieces. I mean, even things like black-eyed peas and turnip greens and mustard greens that are so healthy actually were not considered the good stuff. And our ancestors ate that. But now we're in a different situation and we're continuing in those same processes and eating those foods that are not as good for us, because I think we've internalized this aspect where we separate spirituality from our physical existence. And that's why a big key part or component of what we do with the Hope Health Ministry is that we're talking about triune wellness, that we have to marry the spirituality and our faith and understand that God also cares about this earthly temple. Yes, you know, we building a home because this earthly house is going to soon decay, but right now our soul got to be right here. And I think that there is an aspect where we have actually hallowed into some of our traditions things that are not healthy, just like Sister Ellen said. And we have to start addressing some of these and realize that taking care of our bodies is not devoid of spirituality. Actually, when we connect God to it and make it a God thing, it is so much more, it increases motivation, it increases your joy, it increases your productivity, because we're making it about God. Apart from God, we can do nothing. But unfortunately, there's this stronghold in the church where we have separated some of those aspects. And so we don't treat it as important. We don't treat our overall health and the behaviors that are in line with that as important.
All right, last one. What about water? What about the benefits of water in our diet?
Water is still very important. Every organ in your body needs water. Your brain needs water to function at its optimum capacity. Think of your body like a plant. You wouldn't put pop or soda in it because it would die. So we want to encourage you to drink that water, because we want your kidneys to live a long, long life, because we don't have time to be a dialysis 3 times a week for 4 hours a day.
Okay. All right. So that's it. That's it. Wow. 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 Thank everybody. We had planned on being on only for an hour, but we over. We're going to edit this down and have it available. Again, we want to give another shout out. Again, more love to our wonderful panelists who did an awesome job. We thank Sister Ellen. We thank Sister Nettie. And we thank Dr. Lavora. That's my name for it. Everybody's called Dr. Williams. I call Dr. Lavora. When she know me say that, she know that that's Dr. Minor hollering at me now, nobody else. And we just thank, and I want to just say a quick shout out. I want to thank God for her former president of a state convention out in Georgia. I met him at a meeting and I said I needed somebody. He said, I know somebody. And I want to thank all of our pastors and our regional and national leaders who supported our health mission now through the years. We wouldn't be able to get the things done if it weren't for you. All right, a couple of housekeeping things. Don't forget to take care of our surveys so that we can see how we are improve. We also remind you, everyone, about, we said it before, but remind you again about the NIH's All of Us research program. You see behind me, that is the website, joinallofus.org/together. This program has been conducting monthly surveys of how people are coping during this pandemic. Also, it is one of the few things that is actually having an opportunity where people with sickle cell are included in the research database. There are researchers now using information to find out, hopefully, this is me talking, we can one day have a cure for sickle cell. Find out more about it. Be like the rest of our team and join all of us and become part of this research program so that you can be like us and be 1 in a million. Next Thursday, we're having a webinar at 8 o'clock Eastern, 7 o'clock Central on the new changes in the Affordable Care Act. The Biden administration, it's also some, we'll be doing this in conjunction with Get Covered Mississippi. So if people have had questions about that, we want to be able to offer that to you on next week. Don't forget, April is Minority Health Month. We'll be sharing more information as we go along. And don't forget to like us on our Facebook page, which is National Baptist Convention USA Incorporated Hope Health Initiative, and on our Twitter feed and our YouTube channel. I do want to give a shout out to our team. Yours truly, and Lottie Minor, she may be related to me. Pastor Bernard Montgomery, Sister Bettina Campbell, Pastor Dexter Moraney, Sister Ellen McKnight, you saw tonight, Dr. Felisa Washington, Minister Geraldine Moore, Dr. Desi Levy, Sister Linda Copper, who's been with us tonight, Sister Loretta Miller, Dr. Lavora Williams, you saw her, and Sister Michelle Johnson. All right, and look, we just want to say we will, once we sign off from our social media, we'll hang this for a few minutes if there are other quick questions we have. I just want to make sure before I give out a final say here, Dr. Kimber, is there anything else you want to add before we go to our sign off?
Thank you so very much, Michael. Excellent panel tonight. And I certainly appreciate the information, the informative questions and how you answered tonight. Listen, I love Black people when they sharp, man. Y'all sharp. Mike, thank you. And on behalf of our president, Dr. Jerry Young, we appreciate you. And we look to move to the Southeast. Thank you.
All right. Thank you, Dr. Kimber. We appreciate that. We appreciate that. All right. So here we go. Once again, we acknowledge our president, Dr. Jerry Young, who reminds us to envision the future exceptionally. This has been a production of the National Baptist Convention USA Incorporated, the nation's largest Black denomination. God bless you. God keep you is our prayer. This ends our social media broadcast. Hang tight. We'll continue this for a few minutes on Zoom.